Hey, this is Dr. Masson Harris in Salt Lake City. I see a lot of people with heavy, drooping eyebrows, which give the face a tired and sometimes angry appearance. They can also cause the upper eyelids to droop, blocking peripheral vision. It's often necessary to raise the brows and forehead in order to correct the problem. There are several ways to lift the brows. The most powerful procedure I perform is called a pre-tracheal brow lift, which is used to raise the brows without moving the hairline. This works well for people who always wear their hair forward and who are concerned about raising the hairline or making their forehead more prominent. The incision is made right along the hairline in an irregular pattern, which helps to hide it. The skin of the forehead is carefully elevated and then a portion is removed, which raises the brows. The incision is closed with a long row of stitches, which are removed after about 10 days. The patient wears a pressure dressing around the forehead for 2 days to minimize swelling and bruising. The pros of this procedure are 1, its longevity. You'll probably never need to repeat it. 2, its power. It does a great job of lifting the entire brow and smoothing the forehead. And 3, its minimal swelling and bruising. The recovery is fairly quick given how invasive it seems. Cons include 1, the long scar, which will take 6 to 12 months to completely fade, and 2, numbness of the scalp above the incision, which can also take up to 12 months or more to improve. Overall, the procedure has a high satisfaction rate. It's not well suited to anyone who pulls their hair back or who has thinning hair up front. When we need a powerful forehead lift but need to hide the incisions, we recommend an endoscopic forehead lift. This involves making 3 small incisions behind the hairline, through which we pass instruments to lift the forehead tissues and free up the brows. The entire scalp is pulled up and back and then fixated with small anchors in the bone near the level of the hairline. The incisions are then closed with skin staples and the forehead is wrapped with a pressure dressing. Recovery is similar to the pre-tracheal brow lift. The pros of this type of lift are the smaller scars and lower risk of scalp numbness. The downside to endoscopic brow lift is that it can raise the hairline and may not last as long as a pre-tracheal lift. Another common way we lift the brows is through a procedure called a brow pexy. Pexy means to fixate. This procedure is done through the upper eyelid incision we make for an eyelid lift. Additional dissection is made deep under the brow hairs and up into the forehead. The skin is then sutured into a higher position with deep stitches that the patient won't see afterward. Brow pexy is good for a small amount of lifting, but is mainly used to keep the brows from falling down when excess upper eyelid skin is removed during the eyelid lift. Since no brow or forehead skin is removed, the brows will eventually move back down as gravity continues to work on them. Finally, in select patients, a direct brow lift can be performed. This involves incisions made directly through the skin above the eyebrows. This is best suited to patients whose outer brows are very droopy and to patients with deep forehead wrinkles in which the scar can be hidden. Younger patients and those with thin or very smooth forehead skin would not be good candidates due to scarring. Pre-tracheal and endoscopic brow lifting are performed under general anesthesia. Brow pexy and direct brow lift are performed under sedation with local anesthesia. For all of these procedures, you come and go from the surgical center on the same day. You'll receive a prescription for pain pills and you'll be instructed to take it easy for the first week. If the surgery is performed at the same time as eyelid surgery, you will use our compression goggles and ointment on your eyelids as we describe in other videos. After 1 week, we will remove the staples or stitches from the forehead or brows. It's important not to wear a hat for a few weeks to avoid pulling down on the forehead. Bruising usually takes 2 to 3 weeks to clear up, and swelling may take a bit longer. Complications from these surgeries are rare but can occur. Bleeding and bruising can vary with patients but can be significant. Patients who are on blood thinners may have significant bruising which can travel down into the face. It is also not uncommon to have bleeding that occurs after surgery, even as many as several days later. Holding direct pressure on a bleeding area will stop it within a few minutes. If bleeding doesn't stop, you should call our office. Brow lifting can be a transformative procedure, making your face appear years younger and potentially improving your peripheral vision. Call our office today to schedule a consultation. Thank you for choosing Utah Eyelid and Facial Plastic Surgery. We look forward to helping you feel and look your best.